Welcome to this visual introduction to the Intersections program, which was developed by the Champlain Youth Justice Service Collaborative. Now, you're probably wondering, what is the Intersections program, and who is the Champlain Youth Justice Service Collaborative? To answer these questions, we'll first backtrack to give you some context. So 25 years of government reports in Ontario, the Graham Report, Putting People First, Making It Happen, Realizing Potential, and Every Door is the Right Door, all identify the need for better system coordination in mental health and/or addiction service delivery. In 2011, the Ontario government released Open Minds, Healthy Minds. This strategy outlines how the mental health and addiction system will be transformed to improve services for everyone in Ontario. For the first 3 years, the focus is on children and youth, including families. Systems improvement through service collaboratives is one of the initiatives under the comprehensive strategy. To make the service collaboratives happen, 6 provincial ministries came together. The Ministry of Health and Long-Term Care, the Ministry of Children and Youth Services, Ministry of Education, Ministry of Training, Colleges and Universities, Ministry of Attorney General, and the Ministry of Community Safety and Correctional Services. These 6 ministries are working with the Centre of Addiction and Mental Health. They have established 18 service collaboratives across Ontario, 4 of which are dedicated to junctions between mental health and youth justice. But what is a service collaborative? A service collaborative is a group of people working together to identify a system gap in their community and then figure out what to do about it to make things better. Members include service providers from different areas that work with children and youth, including education, mental health, addictions, youth justice, and child welfare. Some services are in the community and others are in hospitals. Other services focus on specific populations, such as working with Francophone or First Nations, Inuit, or Métis children and youth. Youth and family members with lived experience are also important members of the service collaboratives. So what does all this have to do with Champlain? The Champlain Youth Justice Service Collaborative is one of the 4 justice service collaboratives created and brought together 74 organizations and agencies from justice, mental health, addictions, developmental services, and child welfare from across the Champlain region. When the Champlain Youth Justice Service Collaborative was formed, we had to choose a single system gap to work on. There were many to choose from, but we decided to focus on navigating children and youth through various pathways to appropriate individualized supportive services. Next, we had to figure out what we were going to do about this. We looked at existing programs and services that dealt with youth justice and mental health at the early stages of the justice system. The Youth Justice Liaison and Diversion Program, developed by Public Health England, seemed to be the best fit for the youth within the Champlain region. It was later adapted by the Champlain Youth Justice Service Collaborative to fit the community needs. So what is the Intersections program? Intersections is an early intervention model that focuses on navigation and coordination of services for children and youth with suspected mental health, developmental disabilities, and/or substance use issues who are at risk of becoming justice involved, in order to improve the well-being and reduce involvement with police services. So how does this all work? The police identify the youth that may benefit from navigating to appropriate services. Simply stated from the police's perspective, it's for those youth you deal with where something needs to happen, but you don't know what it is. The police officer makes the referral to the program with youth and/or guardian consent. An Intersections worker then connects with the youth and/or guardian to discuss the program and get a clearer picture of the situation and determine the child or youth and family strengths and needs. Together, they determine which services would best suit the child and youth and their family, and a referral to services is made. Support is provided as needed until the child, youth, and family is embedded into the referred service. The Intersection program is supported by research and was created to fit the specific needs of the Champlain community in order to improve navigation to appropriate services. It is inclusive of the unique strengths and needs of the rural, Francophone, and First Nations, Inuit, and Métis youth. That's it for a brief overview of service collaboratives and the Intersections program. But if you would like more information, please visit our website.